First and foremost, we want to express our sincere thanks to ShareNet International and its staff for everything they do to help groups like ours who fight for the right to sexual and reproductive health. To have the good fortune to be selected and given the grant that enables the completion of this project is an incredible experience, and we are grateful. My name is Amhara, presenting this knowledge product video, and I am project officer at Good Samaritan Association. Good Samaritan Association is a non-governmental organization established in 1996 by a group of professionals to support the most vulnerable women, girls, and families in poverty with very low earnings and with very limited or no economic opportunities. GSA envisions Ethiopian women in the marginalized section of the population free from poverty and their attainment of an acceptable standard health and education service. Good Samaritan Association main intervention areas focus on economic, social, medical rehabilitation, and shelter-based protection services, and also integration of women survivors of gender-based violence, victims of human trafficking, migrant returnees, and internally displaced people. In responding to the protection needs of the migrant returnee, women and children that encounter gender-based violence and other human rights violations, GSA has been providing comprehensive rehabilitation services and safe accommodation along with food, clothing, dignity kits including primary health care, psychosocial support, family tracing, reunification, social and economic reintegration activities. The rehabilitation services provided in well-organized temporary shelters found in Addis Ababa and Gondar town. So, this project aimed to gather data on the specific needs and challenges faced by internally displaced women and girls in accessing SRHR services. By analyzing this information, we hope we develop targeted interventions and dissemination of knowledge products that improved their access to the essential services. Ultimately, our goal was to empower these women and girls to take control of their reproductive health and lead healthy, fulfilling lives. The SRHR problems being addressed in the knowledge product vary depending on the specific program or initiative. However, common issues include lack of access to contraception, unsafe abortion practices, and high rates of sexually transmitted diseases. The knowledge product addressed these issues through a range of strategies such as education and awareness campaigns, improving access to healthcare services, and advocating for policy changes that support SRHR rights. This has been made possible through the implementation of various programs and initiatives aimed at increasing awareness and promoting the importance of SRHR. These efforts have resulted in overall health outcomes for IDP communities. These efforts are crucial in ensuring that the needs and the rights of women and girls are not overlooked during emergencies. By promoting SRHR, these stakeholders prevented unintended pregnancies, reduce maternal mortality, and protect against gender-based violence. The main knowledge products we have produced under these issues discussed above are four. The first of which is a glimpse assessment report on sexual and reproductive health knowledge, attitude, and access among internally displaced persons in Azazo Woreda, North Gondar Zone, Amhara Region of Ethiopia. This was done primarily to provide an evidence-based body of knowledge that would aid in enhancing the availability of internally displaced women and adolescent girls to SRH information and services, as well as to inform concerned parties to prioritize SRH in disasters. The second knowledge product evaluation workshop was planned to validate the assessment report and collect feedback from interested parties before the report's finalization. During the workshop, networking, coordination, and mapping activities were conducted among SRH stakeholders working in the region. The third knowledge product is IEC, Information, Education, and Communication Materials in print and digital versions containing critical SRH information such as SRH service providers, contraceptions, assessment report, and validation report were prepared as a part of communication strategy, focusing on internally displaced women and teenage girls. This strategy comprised project goals for public awareness and dissemination. To enhance awareness and improve IDP knowledge and SRH information and services, over 1,000 pamphlets and posters and booklets were created and distributed at Abromeda IDP camp. The final element is awareness raising events. Based on the assessment reports finding and other evidence gathered during the validation workshop and evidence briefing, knowledge sharing and awareness raising events are being held in IDP communities. Utilizing existing events such as religious services, coffee ceremonies, and community conversations, JSA nurses and health experts continue to hold community meetings at the IDP camp, where they share SRH issues, opportunities, and potential solutions. This is done to provide them with health education, including sexual and reproductive health and rights, as well as to introduce them to various types of reproductive health commodities through our printed contraception guide and posters. Our knowledge products were communicated in a variety of ways, the most important of which were evidence briefing with policymakers, IDP, and host communities, based on the assessment report. Awareness-raising sessions are still being organized by selecting volunteers from the IDP community, particularly women and girls, who are capable of transmitting information through awareness-raising programs organized for IDPs in the camp setting and training the awareness-raising committee on the core issues of SRHR and other emergency, health, and humanitarian aspects. Subsequent sessions on SRHR knowledge dissemination will be organized for broader coverage for the future. Finally, we believe we impacted key stakeholders such as community members in target areas, health practitioners at all levels, governmental and non-governmental organizations working in the area of health, organizations working in the area of emergency and humanitarian services, and cultural and institutional leadership at all local levels, and effectively utilizing an intersectoral approach to create an enabling environment for IDPs to access SRHR and related services. Also, the intersectoral approach, which engage cultural institutions for effective SRHR programming in communities, reaching internally displaced persons as a key population, created impacts within communities and within the life of individuals. This project allows the community itself to develop its own agency to respond to self-identified SRHR priorities in their communities. This focus on the determinants of health and development, including access to health education, gender equity, and safety. This approach helps the project effectively reach its targeted beneficiaries. Instill a sense of community ownership and work toward project sustainability. We think we created a shared vision and influence among stakeholders. As part of our hopes and aspirations for the knowledge product, we are thinking that the development team work to enhance its capabilities and features in order to give consumers access to more precise and true information. Additionally, looking at fresh integration strategies between the product and social media that might improve accessibility and usefulness. Additionally, getting inputs from users and performing user research may assist pinpoint areas that could require improvement and guide next product upgrades. Prioritizing user demands and preferences is crucial for developing a successful and worthwhile information product.